4 common medications that are linked to dementia that can worsen brain recovery after anesthesia. Hi, I'm Sandy Bargeron, board-certified anesthetist, board-certified physician assistant, board-certified natural medicine practitioner, and after years in the OR, I started noticing patterns that no one talks about. A major NIH study recently found that 1 in 10 cases are directly linked to medications not aging. The biggest culprit, the most commonly used ones, Benadryl, used for seasonal allergies or sleep. People taking this frequently have an up to 54% increased risk of developing dementia than those who just take it occasionally. Certain antidepressants, though, the whole group has kind of been implicated in the issue. Elavil or amitriptyline showed an increased relative risk of up to 75% when you take this regularly. Bladder medications like Oxybutynin or ditropan, tolterodine, they showed up to 54% increase in developing dementia, especially if you take the medication longer than 3 months. Now, I think of the people who I hear about who have interstitial cystitis that take this at younger than the age of 50 and take it ongoing for a long time. Of course, the majority of people taking this is 65 and older, but the risk to your brain is significant. Gabapentin. So this is a newly recognized drug that's recognized as high risk. This is often used as for chronic neuropathic pain. The drug is linked to up to 29% increased risk of developing dementia, particularly under the age of 64. What the common denominator about these drugs is that they block acetylcholine, your brain's memory and focus chemical. And over time, that disruption can lead to measurable cognitive decline. So let's talk about anesthesia for a second, one of my favorite topics. If you're on one of these medications routinely and you need surgery, your exposure to anesthesia can expose your brain's lack of resilience. That results in possibly prolonged brain fog, anxiety, memory loss that looks like aging. That's all following your surgery. So what can you do about it? So a good idea would be to limit some of these drugs before surgery. Of course, you need to talk to your healthcare provider, your primary care doctor, and your surgery team before stopping any medications. But more importantly, ask yourself why you're struggling with sleep, anxiety, bladder, and pain issues. Don't just take a pill to block the symptoms. Address the root causes: inflammation, hormone imbalances, nutritional deficiencies, stress, or low-grade infections. Look for natural, brain-safe solutions that heal instead of sedate. I've seen both sides, the hospital and the holistic, and I've created Beyond Brain Health and my upcoming book, Getting Over Going Under, to help protect your brain before, during, and after anesthesia or any other event that can cause significant neurologic stress. It's time to rethink it because your brain deserves protection. Follow me for more information like this.